Thank you very much, Yvette, for that update. So just to emphasize, some of the issues that she said, that all CPD activities are now free, of access, including those that previously required payment. There's been, an adjustment to allow everyone to be able to access CPD, which we feel is quite important. So basing on feedback from users who are having difficulties, managing the payment gateway and everything else, all CPD has now been made, free, of any payments. So go ahead and do any CPD activities that you may have wanted to do, and previously you may not have accessed because there was a payment required. Then an update to the registration, that the platform now requires you to enter your council registration number, which is just the same way you are registered with your nursing council, and you can now be able to download CPD reports, which you can actually submit to your council as a credit for CPD. And we are working with various other councils to be able to actually send those points electronically to the council information management systems, and we will be providing updates in the coming months around that. But at the present moment, you can actually be able to enter into the platform and be able to download the CPD report. I think I can try to actually do a demonstration of that. Let me see if I can do that now. So I will be sharing my screen. And I will log into the platform. And so if you log into the platform, you can simply go to your your icon there. Then you see the dashboard, profile, messages, preferences. This is CPD points. So you can now be able to click CPD points, and you can choose a date range for where you want to see the activities that you have done. You can adjust the dates here, and once you have adjusted your dates, you can then be able to download actually and print a PDF report of your CPD report. If you have any challenges, you can talk to any one of our ambassadors, or even the team, the support team. You can write an email to the support team, or even interact with them via WhatsApp. So this is something that has just been recently developed, the CPD report, and you can be able to do that. So now, coming to the business of the day, which is the fellowships. Let me just set up my slides here. So my name is Admo, and I'm the innovation lead for the Guild Learning Center, and we are working within where we are providing capacity building to the college to be able to deliver a learning management system to facilitate things like a micro credentialing, CPD, and the fellowships, which we are going to be talking about today. So in terms of the presentation today, we are going to discuss a bit about the college history, the VACA Youth Foundation, the Guild Learning Center itself, the fellowships, how they are structured, the core competencies within the fellowships, the assessment of the competencies, then accreditation of training facilities, as well as the next steps. For those that participated in the last webinar last month, definitely there's no new information. We are just re-emphasizing the same aspects, and like we said, this is really in recognition that some nurses failed to come onto the live platform for the discussion that we had last month. But why are we here, and why are we talking even about fellowships and training in East, Central, and Southern Africa? It's because there's a critical shortage of essential skills. And this is something which is documented as the data, which we are presenting there shows. In terms of the nurses and midwives per 1,000 people, our ratio within East, Central, and Southern Africa really just goes as high as 4 or slightly above 4. But when compared with developed countries like Australia, we are doing it maybe less than half, the ratio compared with developed countries. And when you look at, that even most of the countries are actually looking at, at 2 per 1,000 people as the highest, then we are probably doing 5 times less than the developed world. And our trajectory has not really been showing, significant increases, although this data is going up to, 2019, 2020. So we feel, there's real need for us to actually come up with interventions to improve the skills gap, which is in low and middle, income countries, which obviously impacts on the public health, outcomes. So, talking about the college, it was established around 1990, but I think probably 2-3 areas, than that, and then inaugurated around 1990. It has 16 member states, which are shown on this slide here. And it is charged with the responsibility of promoting and strengthening professional excellence in nursing and midwifery in the ECSA region. So ECSACON is an implementing arm of the ECSA health community. The ECSA health community includes other colleges like ECSACOG, COSEXA, CANEXA, but ECSACON is the nursing, implementing agents for the ECSA health community. And in doing so, ECSACON has a mandate, to provide training, and it operates under the underlying principle of a college without walls, just like its other sister colleges like COSEXA or ECSACOG. And next month, if you are traveling to Eswatini, there is the scientific conference, as well as what they call the quadrennial, where they will be having an annual general meeting, which will usher in, a new leadership. That's how, the college is guided by a constitution, and that's how it is, regulated. So this is just a bit, about ECSACON, which for some of you who are members already know. Then VACA Health Foundation, from which I come from, is a social enterprise based in Australia, where it is it operates as a charity, and it was founded by nurses from Africa who are actually working in the Australia. So they are the diaspora, really in Australia, and they are committed to giving back in Africa through capacity building. So the memorandum of understanding between the VACA Health Foundation, which VACA is an African word, which is common in the Bantu languages, like Kiswahili, Shona, and other languages, and it means to build. It's the memorandum of understanding really borders around the provision of fellowships, micro-credentialing, continuing professional development, as well as microfinance. So these are, the aspects that the partnership is looking in terms of, giving back or capacity building, and we'll be discussing, some of this. And if you come to the exhibition booth in Eswatini, you can also be able to ask around some of these aspects like microfinance and micro-credentialing, how it works and everything else. But in this meeting, we are really going to be talking about our fellowships. So, the Guild Learning Center. The Guild Learning Center is the official learning management site for ECSACON, and it provides all the learning needs of nurses in the ECSA region and beyond. Through the power of membership, we believe that the Guild will become a reference provider of world-class nursing education. So some of you, on this call, obviously, you have already registered on the Guild Learning Center, and you may be participating in some of the learning activities that are on the Guild. It is available on web and mobile platforms on www.nursesguild.africa. You can be able to go and register if you have not yet registered. And then if you also want to see other materials around how you can utilize and harness the good for your the Guild for your own good, you can be able to go on the YouTube channel, which is shown on the link there. We'll share this probably in the chat at the end of, during the discussion forum. So the fellowships, what is it really that we are talking about, the fellowships? This is a concept which is borrowed from the sister colleges, COSEXA, CANEXA, ECSACOG, where the college provides what is called collegiate training. And the fellowship is actually a qualification which leads to one being called a clinical practice fellow. That's how they identified a clinical practice fellow of the specialty that they have trained in. So you will have a clinical practice fellow in critical care nursing from ECSACON, a clinical practice fellow in chronic disease management from ECSACON, a clinical practice fellow in midwifery and a clinical practice fellow in neonatal nursing. These are just examples. These are the first 4 fellowships which are launching in January 2023, but other fellowships are going to be added as the faculty grows, as more programs are being developed. So essentially, this really, speaks to where we are going, and that is, the collegiate training, which is really skills-based, competence-based, and there's advantages in that it is really training within your working environment. You are not really going to go into university to go for training for 3 years and then come back. You actually train whilst you are on the job. That's a collegiate training. So how is this learning? Learning structured? The fellowship itself training is a 2-year competence-based applied learning. It is divided into 2 years, a foundational year, which is broken down into 2 semesters, which consists of an orientation and then learning via the learning management system, which is the Guild Learning Center, and then periodically you get exams. And after the foundational year really covers basically the theory of any fellowship that you are training in. So if it's critical care nursing, you are going to be doing your theory for critical care nursing in that foundational year. The second year, which is known as the residence, the placement, or the attachment year, you are attached at an accredited hospital within the ECSA region. And these accredited hospitals are going to be published, and residences they will be providing for, say, for midwifery, for critical care nursing, and everything else. This information is going to be, published in the coming months, as ECSACON is now working with partners to actually implement some of these things like accreditation and really approval at country level by the nursing councils. The residence or placement year is going to be defined by clinical hours. And then trainees are going to complete rotations to gain the skills or competencies defined within their fellowship. But one thing again to note is that these residences or placements are only going to start in 2024, because remember, the first foundational year is going to be 2023 when the fellowships launch. So this is something that is going to come much later, maybe during the course of next year. But we are just sharing for informational purposes so that you are aware about the processes leading to these fellowships. So what are some of the core competencies that have been defined from a fellowship perspective? But I want you to note that these are not cast in stone, and they will vary according to the exact fellowship. So for midwifery, there will be some variations in terms of the core competencies. For critical care nursing, there will also be some variations in terms of the core competencies. So, but generally, the fellowship is defined, by some of these core competencies, where in the clinical, domain, you are going to be talking about health assessment and diagnosis, planning, implementation, as well as evaluation. The professional domain talks to complex decision-making, ethical and legal issues, communication, as well as, nursing informatics. Managerial domain talks to unit management, team management, health and safety, things around quality assurance. And then the education and development domain talks to personal development, how you also develop others, evidence-based practice, as well as, entrepreneurship. So these are the high-level encompassing competencies which are defined, by the fellowship training. But like I said, when you come down to the, specific fellowship, you will find that there will be some variations within those which speak to the specific, fellowship. You may be asking yourself, how are these nurses who are going to be training as fellows going to be assessed whilst they are doing their fellowship? So there is a whole range, of methods which are being, which are defined in the curriculum, which will be shared once the curricula are finalized. But things like direct observation of nursing care within the clinical setting, this can be done by a mentor, or a supervisor. Direct observation of simulated nursing care, this can be done in the simulation or skills labs. Discussion forums, direct questioning, completion of reflective work, related workbooks, project work, guided projects, like a nurse can be asked to develop guidelines maybe for managing diabetes within, in the context of maybe the environment in Zambia or in Lesotho, for example. And that can actually be, an assessment of a competency. Then having a portfolio of evidence, like attending other workshops and everything else, this can be, accredited for units. Then documented feedback from colleagues or patients or relatives can be used, as well as, objective structured clinical exams, which are OSCEs, and these will be standardized across, the region. So this is just, a snippet in terms of, some of the things that have been put in the curricula in terms of how, the competencies are going to be, assessed. And this is just really, again, for informational, purposes. You can be asking again, where are some of those accredited hospitals going to be? So some of them are going to be district hospitals, some of them are going to be provincial hospitals, some of them are going to be central hospitals. But the aim and the target is that at least 2/3 of the accredited learning facilities must be outside the capitals or urban centers. Really, this is an aim to actually improve access to learning. So regional hospitals, district hospitals are going to be targeted, if they have the necessary resources and trainers available, for them to allow, fellows to actually be accredited at such sites and improve, access without, disrupting the, like location or placement of workers are within the country settings. So the idea is really to create an enabling environment where learners can be able to actually, access these fellowships closer to where they are currently working. Then that improves, retention within those regions as well. You can also be asking, where are the mentors or trainers going to be coming from? So they are going to be fellows recognized through prior learning by the college, and these fellows could be coming from training institutions, as well as universities. And that's just, again, something for informational purposes. What are going to be the prerequisites? This is where we have probably some new information arising, from like some discussions which are currently ongoing, but proper information is going to be, published by the college and also maybe at the conference in Eswatini. But could we please mute our microphones? The prerequisites are that for you to enter into the fellowship, you are going to be a registered nurse, and you're also going to have done the college membership training. And this college membership training is fully online, which is, it's already available, but it's still being, looked into. Some of the areas which are being added, like nursing leadership and management. There's a course which is going to be published soon, and there are other components which are also going to be added. But at the end, the college membership really is a prerequisite. So you first do the college membership. You can't get into the fellowship without doing the college membership training. And after completing the college membership training, you can then apply to join one of the specialized fellowships, either critical care nursing, midwifery, chronic disease management, or neonatal nursing, depending on your interest and seats that may be available. So this is something to really note: a registered nurse, then college membership training. You can then be able to enroll into the fellowship, and these are the prerequisites. So what are the next steps now leading to the fellowships? There are various processes which are happening at present moment, like the curriculum are being reviewed, and input is being provided. There was a meeting recently in South Africa where the regulators were brought together to provide their input. And the discussions are, at an advanced level in terms of preparing, for the launch, of the fellowships. And like I said, more information is going to be, published in the coming months as well. At the conference in Eswatini, for those that are going down to Eswatini to attend, you will also hear more about the fellowships and the next steps. But in a nutshell, for those that may have had questions to say, what are the fellowships about? What are they talking to? What are the subjects that are being covered? How are they going to be, started? This is something that we thought we could do in the form of a discussion, like the meeting that we are having today, and then allow also some live interaction in terms of people that may have questions. The ones that we can answer, we can then be able to answer. You can also go to our site, www.ecsaconline.org, www.nursesguild.africa to be able to register and also get more information around the membership training, which is already available, and some of the scholarships which are being offered to get into the membership training. Those facilities are already available. So I would like to say I thank you, and and I will be able to pause. I will be able to pause now. Allow having discussions. So for those that have been on the call already, we can be able to raise our hands and start having a live discussion around the aspects of the fellowship. I would like to recognize, I think the ECSACON president has just joined us, Madam Kio, and I will probably give you a chance to talk to us before we can start our discussion. So, Madam Kio, good afternoon. I would like to recognize your presence and offer you, this opportunity to just greet the nurses here. We have about 50 nurses on the call, and really we are discussing the upcoming fellowships and also the upcoming conference in Eswatini. So you may start by telling us about the upcoming conference in Eswatini, Madam Kio, and then go into the fellowships as well. Over to you.
Thank you very much. You know, I was even thinking that I'm very, very late. I'm going to find you already closing up. But anyway, let me greet everyone who is with us here today and welcome you to this webinar. I think you have heard, if you are not ambassadors, you have heard from your ambassadors about the ECSACON fellowship programs that are going on. And I hope you are really taking them serious, as I can even see from the numbers that are attending here today. So let me just go to the point of talking to you about the upcoming conference, because it's almost here. The conference will be hosted from the 13th of September to the 17th in Eswatini. So we are still requesting you nurses to register to attend the conference. It's a scientific conference, the first 3 days, and then the next 2 days it will be a quadrennial general assembly. At the quadrennial general assembly is for members. We will be discussing the college issues, and I hope you will be there to bring ideas on how we can improve the college. But as for the scientific conference, I think by now we have already closed the abstracts, and I want to believe that those who have sent abstracts, you have already received your feedback, whether you have been accepted or not. But I'm very happy to tell you that I was informed that only 2 abstracts were not accepted. So you can imagine, out of the many abstracts that were sent, only 2. But also their authors were informed on what to do next time. Otherwise, it was a very good abstract when the abstract reviewers were very happy about that. Otherwise, at the scientific conference, we also have partners who will be presenting. I just want to excite you to want to go to this conference. If you have attended some conferences before this one, I'm telling you, we are bringing a lot more of partners. And these partners are ready to share with you what we have been doing with them behind the scenes, which we're not seeing. There are going to be presentations on a lot of areas that you will be interested in. So let us all prepare. I know it needs money, like especially for transportation, and you need money for accommodation. But you know, when you learn, education also is expensive on its own, because it stays in you and you cannot give it to anyone. So as much as we cry of the money, let us just know that, but we need to. All I want to believe that all of us, our nursing councils, they want us to have CPD points for renewing our licenses. And through these conferences, you also earn points to renew your licenses. So let us be prepared, my colleagues, to attend. Otherwise, today's webinar, you will hear from the organizers, but let me just touch on this one to say we are having a partnership with the VACA, and this partnership, I'm telling you, has brought us a lot of very exciting areas that I want to believe the nurses also will enjoy them. As we are here today is one of the areas that we are working on with them. The webinars where we are educated, where we also express our views, and where we also are free to tell them what we want to be discussed in the next webinar. So just feel free what you are going to be learning, and also feel free to share what you also want to come up in the next webinars. The other thing, we are talking of fellowship programs. We are saying we are a college, and our college has not been, doing what we expect from a college, like providing trainings. So we have now partnered with VACA to help us to make sure that dream comes to life. And we have already started. I think those of you who visit the website, we have seen that our website is now functional, and we have some CPD that we are taking from there. So let us visit the website and make use of those CPD. They are very good and very relevant to us as nurses and midwives. So let me just take this time, add more to say that's the few words that I wanted to welcome and say to my colleagues here today. I don't want to take much of your time, because also, if we take a long time talking, by the time you start telling them, then the airtime will be finished, or the network will be gone. I know the problem that we are facing. So thank you so much for giving me this time to greet the colleagues and also to talk to them.
Thank you very much, Madam Kio. It's always a pleasure. I mean, you've consistently attended these meetings, and I mean, your presence really humbles us. Because as a leader, I mean, giving the direction and also explaining, I mean, the vision clearly means a lot, I mean, to us. So just to acknowledge your words, and also like really the emphasis around the Eswatini, I mean, scientific conference, which we are going to be attending. Really, we are excited about that. I mean, meeting some of the nurses that we've been meeting on the webinars live and discussing and talking, and really to emphasize, I mean, what you have said, to say the college really belongs to the nurses. We want them to be able to come forward and make suggestions and say, I mean, let's do things this way, and this is, I mean, what we want to see. So thank you very much for that, and we really look forward to some nurses coming forward in the coming months and saying, I want to host the webinar, I want to discuss about this, or we are a team from Zambia, we want to discuss about neonatal nursing advances in Zambia, and we have a webinar which does that. Then some, I mean, nurses say, we are a team from Lesotho, we want to co-facilitate, I mean, and share a webinar on, say, I mean, outcomes from, I mean, operational research that we did on the male ward or something like that. These are the kind of, I mean, thoughts that we have as we go into the future, and we would like these webinars to be a place where knowledge is shared amongst nurses. We can even have cross, I mean, collaborations, a nurse from Rwanda and a nurse from Zimbabwe, again, I mean, sharing about, I mean, critical care nursing or something like that. So we are really, I mean, set for exciting, I mean, months are going ahead, and this is what we are doing, I mean, for ourselves as Africans, really defining our course and our future. And like what Madam Kio said, we are also looking around how we can then have, I mean, these webinars also accredited for CPD points, and that's a discussion which the ECSACON executive is going to, I mean, guide us on, and so that, I mean, once you have done this, you can also be able to get, I mean, CPD points to submit to your own nursing council. So with that, I think the discussion that we have had this afternoon is around fellowships, how they are structured, when we expect them to start. The core competencies, like I said, it's just the generic. The exact core competencies are going to be shared in the finalized curriculum, which are going to be shared perhaps a month or two from now to prospective students who will be joining, I mean, the fellowships. So I would like to now open this stage for discussions. If there's anyone who is raising their hand, you can unmute your microphone and go first. I see Daniel Mutiani. Can you go first?
Okay, thank you for the good presentation. I have around 3 questions. The first one, I would like to know, could the Eswatini conference, could we have an online attendance method so that those of us who will not be able to get to Eswatini get to get what is happening in the conference? And the question number 2, I want to know, for those who will not be able to complete the coursework of the foundation year during the stipulated time, will there be an allowance for extension of time? And again, you talked about the residency. There are those who are working in the district and referral hospitals. Can they request to be placed in the same facilities they are working to have their experience? Thank you. I submit.
Thank you very much, Daniel. And your questions are very important. So the first question which I will ask Madam President here to respond to, is there going to be an online participation stream for those that are going not to be able to travel to Eswatini? Madam Kiwa, I will kindly ask you to respond to this one. I'm not so sure if Madam Kyo is still on the call and if she heard me. Yes, she's there.
Hello, I'm sorry, I just rushed out, you know, being a grandmother, I had to go and make those girls to behave.
Okay.
Yeah, I'm back. So I'm
there was
sorry,
a
I didn't
question.
get what you were saying.
There was a question from Daniel, and he was
Okay.
asking that those that are not going to be able to travel to Eswatini, are there going to be some sessions which can be streamed, I mean, say on Zoom or Google Meets, for people to participate remotely?
Okay. No, actually, what we do is we do also have that platform for those who are not attending, but it is at a very minimum fee. It's not
Okay.
for free because, you know, people go there and register for the conference and they pay for the conference. So those who want to attend it virtually, they pay something like, if I'm not mistaken, I think it's $75. But
Okay.
we do
So
provide
information is going. So information is going to be provided around how people can do that. Is that so?
Yeah, no, it will be provided. That's what we
Okay.
did even last year. Those who were attending virtually were given a link for all the procedures.
Okay.
Yeah.
Thank you. Then, Daniel, you had the second question around, if say you don't complete your required work in the foundational year, will there be an allowance? So I would say those things are going to be defined. There will be obviously a booklet or a student, like a procedure manual. So which would define, if a student say doesn't get to certain requirements that are required, how processes are going to be done. So I cannot exactly be able to answer you decisively and say, you will get an extension, but those things are obviously, are provided for within any training program. So I'm sure that will be covered within the students' procedure manuals. Then you also you asked about whether students can be able to replace, can be able to request to be placed at district hospitals or referral hospitals. Like I said, ECSACON's vision, which I will also ask Madam Kyo to come in on, is to have the bulk of the accredited training facilities outside urban centers to enable access. But this is going to be a process, Daniel. It's not going to happen overnight that all the, referral hospitals or regional hospitals are accredited. But that is really learning from the sister colleges like COSEXA, where 66% of their training facilities are outside urban centers. And ECSACON is also taking the same route. Madam Kyo, the question was really about whether nurses located in regional or district hospitals can be able to then train in those hospitals. So I will just allow you to weigh in on that point.
Okay. No, thank you very much, Admo. Like you've already alluded to that, we want all our nurses to have access to these trainings. But I just want to say, you know, before we can even accredit a hospital to be used as one of our training sites, there are some questions, or there's a questionnaire that we use. I'm just afraid to say we might have challenges with hospitals that are in remote areas, maybe not meeting the criteria because of the limitations of training material and so on. But you know, we said the first 2 years will be online and not really needing to go to any practical site. So as they start, that's when also we will be talking to the management, to the ministries, to the decision makers, to at least try to provide those things that will be needed to make the facilities to be accredited, because it is very important to consider those nurses and midwives who are not in towns. So I think our communication and our advocacy will continue to ensure that we get the minimum necessary equipment that can. It looks like I'm off. Did you get me?
Yes, you can continue, Madam T.
Okay. Yeah, no, I was just saying that we are doing our advocacy to make sure that our decision makers at least try to bring minimum required, equipment to the facilities so that the nurses and midwives in the remote areas also can have access. So that's our aim, that's our wish, that everyone will get the accessibility to the trainings.
Daniel, so I hope you get, what the president is alluding to, that yes, that's ECSACON's aim, but it will also depend on the facilities readiness. So it's going to be a multi-stakeholder approach in terms, of getting some of, the facilities, especially in the remote communities, accredited. But that's the vision, and that's the direction that ECSACON would want to go to ensure that there is access. I don't see any other hands raised. If there's someone who wants, okay, Kija, can you please go ahead?
Yeah, thank you very much, Admore, for making a clarification about the fellowship program, and also the clarification that have been highlighted by our president, ECSACON president. But my interest is on the programs, the fellowship program. This 2-year program. Let's say in my country, 2-year is a master program. And when a graduate, a nurse who graduate from those programs being offered a specific certificate for practice. For example, maybe in critical care, and we know if you have a graduate with a critical care, that means he's going to work in the ICU intensive care unit, is going to work in the emergency department. Similarly, neonatology, that means needed to work on the unit, and the midwifery, we know about it. But when you go to chronic disease management, we have several conditions that are being grouped under this chronic disease. For example, myself, I'm a specialist in nursing oncology. I know how are we dealing with the cancer patient. But chronic disease, you can find those people with diabetes, those people with the cardiovascular complications. So, of course, I'm thinking, how can we make this be implementable? This program.
Matenda Suga.
Can we please mute our microphones if we are not the ones speaking? Kija is on the microphone.
So I'm thinking if it is possible, maybe because you are trying to develop a curriculum and to define it, maybe you can think of making more specific. Maybe chronic disease, focusing on a cancer, focusing maybe on diabetes and so forth.
McDonald Kalanga, may you please mute your microphone to allow
Okay,
Kija to
I'll
continue?
just do like that. Okay, thank you so much. Okay.
Okay, thank
Kija,
you.
can you proceed?
Maybe if we specify what chronic disease do we want, and this will make to be more absorbable in the employment systems. For example, if you produce a graduate with a specialized career in the oncology, that means this person is going to work in a cancer unit. Similarly, if you are focusing on diabetes, maybe it's going to work in maybe in internal medicine. So rather than putting them together, I think you understand my comment, Mr. Admore.
I hear you, Kija. So just to provide a quick response around the thinking and the mindset behind the chronic disease care, fellowship. If you look at the outcomes in terms of, deaths and the rising burden in terms of, non-communicable diseases like hypertension, diabetes are combined, cardiovascular, diseases. There is an understanding that whilst we have been having some specific programs addressing things like malignancies, cancers, like you rightly say, or HIV and AIDS, there is a shortage of, McDonald, can you please mute your microphone to allow others in the meeting to really participate?
Okay, thank you.
There is an understanding that there is a missing link in terms of capacity building nurses who may be working in the outpatient departments or primary healthcare facilities who are managing all these conditions. They meet diabetes patients, they meet hypertensive patients, they meet, cancer patients from a screening perspective, not really from a managing perspective of, managing the malignancy itself, Kija. So we are missing a nurse who can provide maybe that ability to screen for malignancies, or that ability to screen for diabetes, or manage a patient who has already come back from a physician, in terms of continuing management. So the chronic care disease fellowship, which is bringing together these chronic diseases, is trying to bridge that and provide a skilled nurse who can work competently on the, say, internal medicine units, or in the outpatient setting, or in the primary healthcare setting, with an ability to extend their knowledge in general nursing, but now from the fellowship to providing more comprehensive care around these patients who are coming, in these outpatient settings. But I hear, what you have said, and we will be able to discuss with the curriculum education team and transmit, some of these, feedback. And the president also is here. So we hear, your suggestions around having those specialized, fellowships for, chronic diseases. But the idea really also is to say, look at the amount of nurses that we have, and the shortage of skills that we have, and already the work that they are doing, that they are meeting these patients with hypertension, with diabetes, but without those extra skills to manage them appropriately. But Kija, thank you very much for coming forward and raising that question. There's a question, Madam Kio, which is saying, when are you starting the PhD fellowship? I would ask maybe Eric to really provide maybe a written submission around their thoughts around PhDs. Collegiate training really is based on skills and providing, upskilling. But I think ECSACON at some point in time is going to be having some association with, associate universities, and then people can probably go to that, PhD level. I'm trying to look, for hands. Is there anyone, with their hand? I think Florence Chikondo, at some point you raised your hand. You can come in with your question. Madam Kio, if you want to say something.
Yeah, no, thank you very much for the explanation that you just gave on the chronic disease management fellowship, that, this one is not a specialty area. And I do acknowledge and agree with the speaker that it is very important to train nurses at that specialized level, like maybe oncology nursing, just take them one by one. But, we are just starting. I want to make it clear to you, colleagues, that ECSACON is just starting the fellowship programs. And when you start, you look at, you start small and then move up. So we just felt we made a needs assessment, and we agreed that these are the areas that the countries or the members have indicated that they need skills on. That's how we chose the 3, but they are not the only 3, but we just prioritize them like that. And then going forward, as we grow, we are going to have specialized courses that people will be taking as at a master's specialized level and PhD going up. So for now, it's just a starting ground, and we hope we will improve and grow and even bring in more programs. So I think that's all that I can say for now, Edmo.
Thank you very much, Madam Kio. Florence, do you still want to come in with your question? Florence Chikondo.
Hello.
Yes, proceed, Florence.
Okay, afternoon. I'm Florence Chikondo from Zimbabwe. I wanted to ask that, am I going to be allowed to do another fellowship after completion of the first fellowship, since the programs on offer are few? For example, maybe for now I can take midwifery or neonatology. Then after some years, maybe I find that we have offered infection prevention and control, and maybe I'll be interested in that. Will I be allowed to do it again? And my second question is that, are these programs diplomas or what? What is the qualification? For example, here in Zimbabwe, for a post-basic qualification, the Nurses Council of Zimbabwe credits you with a bar for that. And my question is that, for these fellowships, is the Nurses Council going to credit us with bars as a post-basic, or it will just be a diploma, or is it just a certificate? For example, you said that there is critical care. Is it going to be equivalent to the ICU or the ICN being offered here in Zimbabwe? For the midwifery, is it going to be equivalent or what? Is it a certificate or a diploma? Thank you.
Thank you very much, Florence. So your questions are very important and quite critical. And the first question really is, are you going to be allowed to take multiple fellowships? So that really depends on the availability of seats. You will find that, to be able to train in these fellowships, it costs a lot of money. And what ECSACON is trying to then be able to do is to also engage partners, like what Madam Kio was saying, that if you come to Eswatini, you will see some of the partners that the college is working with. ECSACON is trying to engage partners as well as governments to actually provide, funding for the seats that will be available. So, and then again, an individual may be able to pay for themselves once the fees are published, that it costs so much. So for you to be able to do multiple fellowships, my answer would be, it would depend on the availability of seats and also issues around equity. So you may not be able to do multiple fellowships maybe on scholarship, but if you are paying for yourself, you may be able to do that. That's, a principle around equity and cost, measures. So I'm just really highlighting, the high level approaches in terms of management, but it's a possibility that someone can do 2-3 fellowships, but who funds maybe that is where the question is going to be coming from. Then the second question around what is the fellowship qualification? What is it? So the concept of collegiate training is important for us to recognize that the fellowship itself is actually a qualification. The fellowship certificate itself is actually a qualification. And it is going to be recognized by the Nursing Council is, a qualification for you to be able to practice within a defined scope of practice. Just like the post-basic training that you talked about, Florence, that a post-basic training in Zimbabwe in midwifery is recognized by the Nurses Council, and you get bars for that, and you get a diploma. So now, with the fellowship, with the collegiate, fellowship training from ECSACON, as the curriculum are being developed at present moment, the fellowship is hedged, or it is equivalent to a degree qualification. And the training, like we said, will consist in total of 3 years, 1 year for the membership training, then 2 years for the fellowship training. So upon completion, when you get your fellowship, certificate or your fellowship qualification, that certificate or that qualification is equivalent to a degree in the fellowship that you have been training. So say a degree in midwifery. So that is really, how the fellowships have been built. And I think the processes around what happens, for that recognition and everything else will be handled at the Nursing Council level once the curriculum are finalized and approved. But in terms of, where we stand at the moment, this is exactly, as I speak, to say the fellowship is equivalent to, a degree qualification, and the training will be, 3 years in total, consisting of the 1 year membership as well as the 2 years, fellowship training. Then there's a question in the chat, which Eric has posed to say, can a diploma holder enroll in fellowship? Definitely, the diploma holders who are the registered general nurses, this is what we said, that's one of the prerequisites, plus you completing your membership training in ECSACON, then you can be able to enroll into the fellowships. So I guess I've answered that as well. Is there any other question? We'll just proceed for 3 more minutes before we close this webinar, because so Florence, you can come in again. Okay, Atimaku, you come in after Florence. Okay, there are more questions, so we may extend maybe by 10 minutes. Catherine has a question to say, will the fellowship be recognized across the countries? Definitely, ECSACON is working with all member councils in the 16 states to have approvals. What we are not sure is, will all countries, approve at the same time? But definitely, ECSACON is working with all countries. All the curriculum are going to be submitted to all the member states, and they can be able to, approve or, request, modifications, or etc. But the fellowship, once you have, the fellowship approved in Zimbabwe or in Botswana or in Namibia, if you qualify as a fellow in Zimbabwe, you can also be able to be recognized as a fellow in Namibia. So that's how the cross, collaboration and recognition is going to work. So Florence first, then Margaret second.
Okay, thank you for the clarification. I just wanted to ask that you said the fellowship is going to be 3 years, 1 year for membership, and then 2 years for the fellowship. As of now, we are doing the membership programs, which you said are for 6 months. Then after that, we automatically qualify to do the fellowships under a scholarship program. So if we are starting in January 2023, do you mean that we are going to do the 3 years, or is just 2 years? May I get a clarification, since we are already doing the membership program? Are we going to do for another year? That will be 2023, 24, and 25, or what? Thank you.
Thank you very much, Florence. So this is an evolving issue, which we are currently discussing. And like I said, the membership training has already started, like you rightly say. There are some courses which are going to be published to add to the membership component once the membership curriculum has been finalized. And this is going to be happening in the next month. So more information is going to be shared around when the current membership, trainings are going to be able to end. But in principle, the membership training, like we said, is going to, a member is allowed to complete those courses within a year. It's not necessarily to say you are training a year, but people look at the content and say, this content should be completed within a year. That is, the perspective around the 1 year membership training. But because it's an evolving issue, Florence, really, I would want to ask you to just be a bit more patient, and more information is going to be published around the exact first intake in terms of when the first fellows are going to be starting in 2023. Again, that information is going to be published. So thank you for those questions, but like I said, these are evolving issues, and more information around the exact enrollments, the start dates, and the membership cutoff are going to be published. But those that are already enrolled in the membership, please understand that your training is actually going to be recognized. The certificates that you are going to be getting are going to be recognized. What may just happen is that 2 or more courses may actually just be added to the membership to complete the membership requirement, Florence. I hope that is clear. Eric, meaning those with diploma will graduate with a degree, and those with degree will graduate with masters. No, the fellowship qualification is going to be a degree. So if you already have a degree, say in general nursing, but when you qualify from the fellowship, you are having a degree maybe in critical care nursing, or a degree in midwifery, or a degree in chronic disease management. So you are graduating with another degree if you already have a degree, not graduating with a master's. But those with a diploma, definitely, you are having your first degree. But if you already have a degree, it means you are just having your second degree. So, Margaret, can I allow you to come in, and then a shout from Malawi? Can you come in after Margaret? Margaret, shout, then Madam Kio will come and wrap it up. Shouts, can you go ahead? Shout, Simeza. I think Margaret is probably not hearing. Shout, Simeza.
Yes, thank you so much, Admo, Madam President and colleagues. Mine is not necessarily a question, but a comment and a word of encouragement to all of the membership present here. So congratulations, ECSACON, for moving swiftly, seeing that now we are moving towards the direction of having fellows, the 3 programs that you highlighted, that cannot be defined as a mean achievement at all. Our colleagues, somebody might have already said about it, overtook on our platform, 1988, 1990 to date. Our colleagues, the other parties, jumped in quickly, and now they have these fellowship programs. So moving towards that direction, congratulations to ECSACON, Madam President and team, and all of you, the partners, Admore, your organization and the other team. So thank you so much. We are making progress. So my encouragement to the rest is that let's partake of these fellowship programs, and let us encourage our membership, to join and partake of this, depending on the seats, as Admo mentioned earlier on. Let us move with the time. Let us progress, and then see which direction our profession is heading to, which direction our region is heading to. I wanted to make that contribution, Madam President, Admo, and colleagues. I submit.
Thank you very much, Mr. Shout Simeza, for that powerful word of encouragement. Truly, this is acknowledged. Madam Kio, before you come in, there's a question from Beatrix Angola, who says, what about if I only have a certificate in nursing? Will I be allowed to enroll in these fellowships? Is there any special programs for us? So definitely for fellowships, Beatrix, the requirement is that you have a diploma. So you may need to upgrade to become a diploma holder in nursing, a registered general nurse, and then do the membership. But I want to assure you, like what Madam Kio said, and I'm sure she's going to talk about it as well, that ECSACON is also working with other partners to provide other certificate qualifications, which are not fellowships. So there could be other 1-year training, like in perioperative nursing or in some other course, which certificate holders in nursing will be allowed to actually enroll. So the college is not just going to provide fellowships only, it's going to provide other trainings as well. Madam Kio, I would like to come to ask you to come in and wrap up this webinar.
Okay, thank you very much, Edmo. Let me just talk to my colleagues to say this. I think you are aware that all along enrolled nurses or certificate holders have not been admitted as ECSACON members. Our old constitution did not include them as eligible members. So what we did as the current leadership, we sat down and agreed that, but we have nurses who are trained at certificate level. They are still part of us. So we need to bring them on board. We need to work with them, not to leave them out. So what the question is saying is, as we have now gone to an extent of reviewing the constitution to enroll to also include the certificate holders. So we are saying we want these programs to benefit all the nurses. Unfortunately, we are saying these fellowship programs only will be done by diploma holders and degree holders, but not meaning that we have forgotten that we have certificate holders. So we will come to that point because we want to upgrade them first to diploma holders. Then after they have gone to diploma holders, that's when now they can get into the fellowship programs. So as we engage partners, we informed our partners that we have nurses who are certificate level, but they are part of us. We also want them to move. Actually, the fellowship programs, as much as they are for improving the skills, they should also benefit our members. So we are looking into that one for having programs that will assist the certificate holders to have diploma. Then from there, that's when they can get into the fellowship programs. So there was another question which we have answered, Edmo, on recognition. Actually, we did invite all the registrars in all our member countries to a meeting recently in Johannesburg, because at ECSACON we are saying we want to standardize our trainings, we want to standardize curricula. So when we standardize, we are saying when you undergo this fellowship programs, you are from Botswana, when you go to Malawi, when you go to Zambia, you will be recognized because these fellowship programs will be done at that level. But we are also saying we are taking cognizance of the country's own standards, that as much as we are standardizing this, they will also look into their laws to say, does this allow this to be at this level and so forth. So as we standardize at ECSACON, our wish is that everyone who undergoes this program will be recognized everywhere as long as that country has recognized these fellowship programs. So that is where we are right now. So the other thing again to say is I'm happy that Mr. Schultz has encouraged you to undertake these programs. Like we said, you know, our colleagues like the doctors, there are also other colleges, maybe you are not aware. There are other colleges like College of Surgeons, there's College of Physicians, College of Obstetrics and Gynecologists, also at the ECSA Health community. But they are training only their members. So we are also having a College of Health Sciences under ECSA Health community. So this College of Health Sciences also is actually where we got all this support to make sure that as nurses we also move forward with our fellowship programs. Remember and be aware that, you know, all of the other fellowship programs like the doctors are doing, they cannot function without us. So obstetricians need us, surgeons need us, physicians need us. So we are trying to place you people to become specialized nurses who will work as colleagues to those specialists. We no longer want nurses who will only get orders from the doctors without them, also bringing their knowledge into it. So we want nurses who will also advise and also make decisions when it comes to the areas that you will be trained on. So that's what we want to see in the next generation of nurses who are able to stand up and say, no, doctor, this is not the right thing. It should be like that. And we also want nurses who will initiate management of care. We don't want nurses who will be referring everything to the doctors. So that is how these fellowship programs are coming in. So I just want to say, this is just the beginning, and in the future, we are going to have a wide range of specialized areas, even to master's level, because we all know that, if you are trained at degree level, you are not a specialist. We want specialist nurses, but you will get there once you train in master's training. But before we even go to master's training, we will also be exploring other areas as our countries will be advising to say, okay, we need this area, we need this area. So you are here as our members also to advise. That's what I said when I started, that we recognize your contributions, and we will move forward with you as we progress. So these 3 programs are just the beginning. And like Edmo has said, really, we are still even working on the structures of how this program should start. Remember, we are saying we don't want you to undergo trainings, which at the end will not be recognized. You will have wasted your time or even wasted your money if you are paying for yourself, and then at the end you are not recognized. We are still working on the structures to ensure that once we kickstart the programs, they will be recognized and you will benefit from those programs. So we also want to make sure that when we say this is a degree program, why are we saying it's a degree program? Is it according to the standard? So we are still going to align ourselves with, people who will assess and see if we say this curriculum is a degree curriculum, are they going to see it as such? So these are the things that we are still working on, but we are almost at the end of that, because very soon we will be knowing whether this is a degree or what. But the curricula, I want to assure you that these are done by educated people who are lecturers in the universities in our countries, who are also from other partners that we are working with. We are not taking anyone like from Norway. Well, when you train a degree, you cannot train a degree with another degree holder or a diploma holder. When you train a degree, you will need somebody at a higher level than a degree. And we have taken that into account, and we make sure that our curricula are done by people who already know how to do curricula and specialized in that. So we want to give you a very fruitful and very well fine-tuned programs that will not lose its, will not lose its importance when we start. So we are getting there. Actually, I just want to say, we said we are going to launch in January, but launching in January does not necessarily mean that the program will be starting or not. It will depend on whether the structures are well placed and ready to start. It also involves accreditation of facilities, like I said. So far we have sent the 3 curricula to the registrars of your member countries. We want them to take time to look at them and see what we want to bring to you, whether it is something of substance or of substandard, because they are also our members. They will also advise us after critically looking at the curricula to say, in this one, maybe do this, maybe do this. We are just waiting for them to go through them and give us feedback. So I think, Edmo, I don't know if I left out any of the questions that our participants here may have brought out. So
No,
that's all I can say for now.
thank you very much for those, overarching comments, which precisely say the truth around the path that ECSACON is taking, and I think that was clear. So just to acknowledge everyone who participated in the chat, Eric, Pamela from Mauritius, there was also Kao Pelesia. Then January, you requested for the slides. We are going to make arrangements around sending the slides. Then Gositang from Botswana will send some greetings. Fauste Uingabire, your comments around that leadership is missing in nursing is really critical, and this is talking to bedside leadership, not necessarily leadership by position. Those comments are noted, Fauste, and they will be transmitted to the curriculum development team. You also requested for the slides. We are going to make sure to that. Gositang, that was also a word of encouragement, just like Mr. Shouts. Then the PhD fellowship question, we talked about that, it's not necessarily offered by the college, but associations with the college that are going to be established are going to take care of that. Then Eric is talking about publishing a research paper. So Eric, we would like you to reach out to us through the email that we sent in the chat, support@nurses.guild.africa, to discuss some of those possibilities around our research. Then we addressed the question around whether diploma nurses can enroll in fellowship. That's a definite yes. Recognition, accreditation across countries, Madam Kiwe has addressed that. The cutoff dates around the membership training and everything else, like we said, those things, information is going to be published in the coming months. Sylvie from Uganda appreciating the ECSACON initiative. The degree component, we've discussed that. Some slides request from Christy, we are going to do that. The 3 areas of the fellowship, which are going to be starting: midwifery, critical care nursing, chronic care disease, as well as neonatal nursing. The issue around enrolled nurses or certificate holders in nursing, Madam Q has addressed that. Anita, you're appreciating ECSACON for the initiative, Shelin as well. Then Redempta Matindi, also appreciating the program and what the president said, that's acknowledged. And then, do you allow credit transfers from other institutions? This is Eric again. So Eric, there is going to be a platform or a system of recognizing prior learning, and ECSACON is working, when it is working, on the standards, for the fellowship. So definitely credits can be recognized through that system, but that is going to be really worked out by the academics. So watch out, for the information request. For slides, we note that we are going to make sure that we send, the slides to all the participants in this meeting. Request for slides, I think, then how about a specialty in the research field? I think Madam President is listening. Moneko from Malawi is saying, I'm looking forward to the upcoming conference in Manzini. So I think Madam President, Moneko is simply saying, I'm coming to Eswatini to meet you. Then Sibuya Wilson also saying, thank you for the initiative. Alice Alam says, will the fellows get an opportunity to visit other well-equipped facilities in other countries for experience during the fellowship? So this is Alice Alum from Uganda. I think she's speaking to really exchange visits within the fellowship. So again, Madam President, I assume you are listening to that. So now I would like us to close the meeting in the next 5 minutes. Winfrida, I see a hand. Is this a burning question? Could you possibly be the last question before we wrap up? Winfrida Joel. Agnes Hassan also requesting for the slides. So the slides we promise, we are going to be sending that. Are you sponsoring some of the conference among the ambassadors? No, Martha, that's a question. So there is no sponsorship, which has been made available for people to actually go to the conference. But this is something that we are going to be able to look towards in the future if funds permit, Martha. But to be honest, travel and obviously accommodation, those things are expensive. And these initiatives that we are offering are being offered from a charity perspective. So from that, we are not really in a capacity to actually, sponsor. But I think in the coming years, when more partners are on board, it would have been lovely really to have some people sponsored to go and attend, because we know, the economies are really, quite tough. Then Elisha Gable, thank you very much, but please assist us this profession. Please assist this profession, and welcome to Talk with Nursing Students in Tanzania. Welcome very much, Elijah Gable, President of Nursing Students. Oh, that's lovely. Elisha, thanks, for coming forward. So we have sent in our email in the chats, which is support@nursesguild.africa. Those that want to reach out towards us, those that want to host some webinars that have topics to discuss, please use this email so that we can be able to plan the webinars in the coming months. And the other issue is that we are going to come back with another fellowship for webinars sometime in November, when all these processes that we are talking about behind the scenes have happened, and we have clearer information around the exact launch, like what Madam Kio said. This webinar really is just to build awareness, because we know on the Guild Learning Center, we have a page which is talking about fellowships, and we were having a lot of nurses asking, what are these fellowships? What are they going to be doing? So this is really just, an honest and open way of communicating the vision which ECSACON has, and this is why we had this fellowship. But like what Madam Kio said, a lot of processes are happening behind the scenes to prepare for these fellowships. So we will come back, circle back again in November, and have another webinar and have this discussion. But between then and November, obviously, we are going to be having our monthly webinars. And if there is any nursing association, if there is any group of nurses, any individual who wants to present, in the webinars, this is your platform. Like what Madam Kio said, let's work together. So with that, we are going to close this webinar for this month. And thank you very much. And we look forward to seeing you again in the last Saturday of September, where we will be having another webinar, and we will discuss and share, the topic for that webinar in the coming weeks. Thank you very much, everyone. Have a good afternoon, wherever you are, Central Africa, East Africa. Please enjoy the rest of your weekend. Goodbye.
Bye-bye.
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 Bye-bye. Thank you very much.
Thank you, Swaziland.
I really appreciate it. Thank you very much.
Have a good
Yeah,
night
let's
from
meet in
Botswana.
Eswatini.
Bye-bye.
Bye. Bye.
See you
Bye. Hello.
See you in Eswatini. Bye.
Botswana.
Bye, Lucy. Bye, everyone. Lucas, Mary, David.
Bye, ciao, Celestia.
Hello.
Hi, Miss Pendo. Just amazing to see you here.
Margaret, Atimaku, you are still on the call, right?
Hello. Hello.
Hello.
Hello.
Yes, is that Margaret?
Hello. Yes. Also the opinion, if you people could share the slide, because where I'm facing a lot of challenges with them, it had been raising. I started very well, but in the middle, when it started raining, I was not speaking anything. Then it stopped when people were raising concerns.
It's okay. So we are going to share the recording, Margaret. That's why we were recording this meeting. So you have the full discussion, I mean, in your own convenience.
Thank you so much.